The bond with an Alaskan Malamute is forged in loyalty and shared adventures. But behind their powerful build and striking looks lies a vulnerability to certain health conditions that every owner should understand. Awareness isn't about fear, it's about empowerment, enabling us to provide the best possible care for these magnificent companions. One of the most significant health challenges Malamutes face is cancer. It is the leading cause of death in many large dog breeds, and the Malamute is no exception. Among the various types, lymphoma, a cancer of the lymphatic system, and osteosarcoma, an aggressive bone cancer, are particularly concerning. Hemangiosarcoma, a cancer of the blood vessel walls, is another threat, often developing silently on the spleen or heart. Early detection is paramount. Owners should be vigilant for signs like unusual lumps or swellings, unexplained weight loss, persistent limping, or a sudden decrease in energy. While a lump may just be a harmless fatty deposit, any new growth warrants a veterinary examination. Regular checkups, especially for senior Malamutes, allow for blood work and physical exams that can catch abnormalities before they become severe. Another major health concern for this breed is bloat, medically known as gastric dilatation, volvulus, or GDV. This is a life-threatening emergency that occurs when the stomach fills with gas, and then twists on itself. This twisting action cuts off blood flow to the stomach and spleen, and blocks the escape of gas. The condition can be fatal in a matter of hours. Malamutes, with their deep chests, are anatomically predisposed to bloat. Symptoms appear suddenly and include a visibly swollen abdomen, unproductive retching or trying to vomit, restlessness, and signs of pain. Immediate veterinary intervention is critical for survival. To help reduce the risk, owners can feed their Malamutes smaller, more frequent meals instead of one large one. Using slow feeder bowls can prevent them from gulping down their food and swallowing too much air. It's also wise to avoid vigorous exercise for at least an hour before and after meals. Some owners opt for a preventative surgery called a gastropexy, which tacks the stomach to the abdominal wall to prevent it from twisting. This is often done at the same time as a spay or neuter procedure. Heart disease also poses a significant threat to the Alaskan Malamute. While various heart conditions can occur, one to be aware of is dilated cardiomyopathy, or DCM. In this disease, the heart muscle becomes thin and weak, making it unable to pump blood effectively. This can lead to congestive heart failure. The signs of heart disease can be subtle at first, often mistaken for normal aging. They might include coughing, especially after exertion or when lying down, difficulty breathing, reduced exercise tolerance, and fainting spells. While there is no cure for DCM, early diagnosis allows for management with medications that can improve heart function and quality of life. Veterinarians can listen for heart murmurs during routine exams, and an echocardiogram, or heart ultrasound, can confirm a diagnosis. Responsible breeders often screen their breeding dogs for known heart conditions to help reduce the prevalence of inherited cardiac issues within the breed. Maintaining a healthy weight and providing regular, moderate exercise is also beneficial for a Malamute's overall cardiovascular health. Hereditary conditions, passed down through generations, are another area of concern. One such condition is polyneuropathy. This neurological disorder affects the peripheral nerves, leading to progressive muscle weakness and atrophy. Early signs might be subtle, including an awkward gait, exercise intolerance, or changes in their bark. As it progresses, it can lead to significant mobility issues. DNA testing is available for a known form of this disease, allowing breeders to make informed decisions and avoid producing affected puppies. Another inherited issue is cataracts, which cause the lens of the eye to become cloudy, impairing vision and potentially leading to blindness. While often associated with old age, hereditary cataracts can appear in younger Malamutes. Reputable breeders will have their dog's eyes certified clear by a veterinary ophthalmologist. Hip dysplasia, a malformation of the hip joint, is also common in large, fast-growing breeds like the Malamute. It causes instability and wear on the joint, leading to arthritis and pain. Responsible breeders screen for this using X-rays, helping to ensure that only dogs with healthy hip structures contribute to the breed's future. Finally, while not a disease, accidents and injuries are a preventable cause of premature death. The Malamute's strong prey drive and independent nature mean they can be prone to wandering if not securely contained. A loose Malamute is at risk of being hit by a car or getting into fights with other animals. Secure fencing is not a suggestion, it's a necessity for this breed. They are also powerful diggers and capable climbers, so fences must be deep and tall. During warmer months, heatstroke is a serious danger. With their thick double coats designed for Arctic climates, Malamutes can overheat quickly. They should always have access to shade and fresh water, and exercise should be limited to the cooler parts of the day. Never, ever leave a Malamute in a parked car, even for a few minutes. Knowing these risks allows us to create a safe environment for them by combining responsible breeding, diligent observation, preventative veterinary care, and a safe home environment. We honor the deep and enduring companionship these incredible dogs offer. Understanding their vulnerabilities is the greatest tool we have to protect them and ensure they live long, healthy, and happy lives by our side.